So all of you got the information regarding the systematic approach. The systematic approach, what we have just got it, that if there is a patient who being unconscious, we have to firstly follow with the BLS, and that BLS will turn up into, if the condition went into ROSC, then we have to complete with the primary assessment and the secondary assessment. Primary assessment, we have to take care of A, B, C, D, and E. ABC is a continuum process in which the airway management is very much essential and important. For that point of view, the objective of this particular webinar is to get this ACLS training implemented to every one of you, because that requires skill evaluation and testing, that is PWW, practice while watching. So in that airway section, we are going to cover all the basic airway adjuncts, advanced airway adjuncts, advanced techniques. Along with that, if there is nothing is available, what to do with your bare hands along with the gloves. That is the skills that you are going to learn in the airway skill stations. That is a particular specific point for the airway management. Then comes the B. B stands for the breathing. Breathing require what? Supplement of the oxygenation by the help of either positive pressure ventilation through the bag wall mask or use of ventilators. So if there is a use of ventilators or bag wall mask, they have given you information that the breathing rate should be getting changed. And what are the other specific measures that also we are going to highlight, particularly in the ACLS sessions. Now the last comes about the C, that of the continuum process. C stand is a challenging circulation point of view that we have to manage with the inotropes if required for the BP management. If the BP is not getting increased by the help of the fluid, then we go for the inotropes. Then we followed with the patient is either comatose or non-comatose. If patient is comatose, then we have to go for the targeted temperature management. And that targeted temperature management, for how long we have to get it introduced to the particular victim or the subject who is in front of us, simultaneously what should be the rate of the fluid and how much fluid should be provided. That also comes under the coverage of this advanced cardiovascular life support whole course. Later, they have talked about the disability and exposure also. So this is covering in the section of the primary assessment, followed by your GCS. GCS comes under the AVPU, alert, verbal response, painful stimuli, and unresponsiveness or unconscious state. So this is the coverage of your primary assessment. Now comes the secondary assessment. In secondary assessment, they have given you about the reversible causes. We have to turn on the reversible causes quickly for the 5H and 5Ts. Simultaneously, they have given you to take the history also. History in the form of the sample. Sample where S stand for sign and symptoms, A stand for allergy, M stand for medication, P stand for past medical history, L for last meal, and E for event leading to that particular scenario. So if the person is either conscious or if the person is comatose, in both the cases, you can take this sample history from the patient as well as the bystander or the relative of that particular known. But simultaneously, if the patient is conscious, you can take one more history that is known as OPQRST. It is very much essential that what is the onset of the pain, either that is provocating or palliating, quality of the pain, region, radiation, or either it is referral, what is the severity of the pain, what is the aspect of the time with that, what we have given the treatment point management. So that also we can go for the patient who is a conscious. So this is about the primary assessment, secondary assessment. Now there is the another most challenging position of the ACLS, advanced cardiac life support, is that if any scenario happens in front of us, either it is in a casualty department, either it is in a ward, or either it is in a specific intensive critical care unit also. So there is almost sometimes there is a chaos, and in that chaos, what things are getting not to be treated is the patient we are not getting properly get treated. So the proper way of the management of the treatment depends on team dynamics. That is another major concept of the 2020 guidelines. So in team dynamics, there are three major essentials: roles, what to communicate, and how to communicate. There are subdivisions of these, that if in roles, what to communicate, how to communicate, what is your knowing your limitation, knowledge sharing, corrective interventions, summarization and reevaluation, and closed loop communication followed with mutual respect. So how these things are to be done? Again, we will quickly watch a video that may can give us the overview of the session as well as how to be in the challenging point to get rid of the chaos so that our patient should not suffer. So please, without wasting the time, I just let you to the another video. So please be specific with the points what I have given to you, the information, rules, what to communicate and how to communicate. In these, there are 8 subdivisions. In the last of the session, I am going to ask the question from every one of you.